From a young age, I knew I wanted to change my nose and at least have a cuter side profile. And when I started to get older and I actually realized that there was a procedure for this, the rhinoplasty, I was like, oh, I want that. I want to get that done. Dr. Ghavami online with his before and after photos looked way better than a lot of other doctors, because for me, I knew that my hump was a problem, but also my tip was really large and long. And so a lot of the other doctors just got rid of the hump and they didn't even touch the tip. But Dr. Ghavami, he specialized in the tip, and he knew that if you're going to change the top part, you're going to have to change the tip as well. So I looked at his before and afters and I was like, wow, he knows what he's doing. He's not just going to take off my hump and leave me with a still large nose. So I was happy about that.
This is our lovely 19-year-old female from Northern California. She came down for a rhinoplasty, and you can see she already has beautiful facial features, great bone structure, gorgeous eyes, everything is on point, but the nose is just a little bit too large and overtakes her face, so it dominates the real estate of the facial anatomy and morphology. So what we're going to do here, if you look at the profile view, one of the key things is obviously to remove the hump. How much I remove the hump depends on her taste. She showed me inspiration photos, which will tell me and dictate to me the degree of the curve that she desires. And I can deliver that pretty much to a T for people. So we're gonna go ahead and give her a little bit of a curve, and then the other thing that's important, her entire nose needs to come closer to her face. So the bridge and the tip, which projects far out, are gonna come closer to her face. This will allow the rest of her facial features, like her eyes, her beautiful chin and cheekbone structure, to really glow and shine and not be overtaken by the larger nose in the center of it. And then now if you look a little bit three-quarter view, when you turn and you see the other patient's facial side, a lot of people do selfies in three-quarter view. You can see that it overtakes the other side of her face too. So it's almost like a building in the way of beautiful mountain scenery. So what we're seeing right now is a nose that's overtaking her central face that we're going to reduce in every dimension. The last dimension we're going to reduce it in, if you look straight on, you can see a little hint of the hump, but more importantly, you can see her tip has a really wide, bulbous shape, and it's actually very boxy. So we're going to go ahead and refine these features, bring it closer to the face, and reduce the projection of the entire nose, both the bridge and the tip. The last view, when you look way up the nose, but if you look here, you can see how she has some deviation. The septum and some of the cartilages in the base of the nose are poking out, so we're going to straighten that out. She'll breathe a little better. We're going to fix the breathing deep inside with the septal deviation. And then if you look, she has a very boxy tip. So we're going to go ahead and very subtly refine that, but also adding cartilage to strengthen the rim of the nostril. So not only are we reducing, but we're relocating cartilage and adding cartilage for support, for shape, and for aesthetics. So you can see the narrowing I achieved in her what's called dorsal contour or dorsal aesthetic lines here. The tip is a nice diamond shape. The nostrils are strong and straight. Position is good. We overcorrect and over-rotate a little early on to account for the drooping that happens from swelling early. So if you don't rotate the tip a little bit extra during surgery, it's going to look droopy in a year.